Hey, this is Beth, right? I'm providing you a podcast about the peripheral nervous system, the parasympathetic and sympathetic nervous system, and medication classifications for this type of content. And the reason why I wanted to do this is because it relates to different units that you'll be studying in 236 that you've already studied in 236 or will be studying in 236, or you will be studying in 230 in UR 237. So just an overview of the nervous system. We have two main components, one being the central nervous system, which involves the brain and a spinal cord. And then the other is the peripheral nervous system, which is what we're going to talk about mostly here. So when we talk about the peripheral nervous system components, we have first off the afferent portion, which is the signals from the body to the central nervous system that something's going on. And then we have the efferent portion, where this is the signals from the central nervous system to the body saying, hey, react in a certain way. We have the somatic nervous system, which we're not going to talk about, that's involved in this, and then we also have the autonomic nervous system, which we are going to talk about. And of course, with the autonomic nervous system, we have the parasympathetic nervous system and the sympathetic nervous system. Now, when we're talking about the sympathetic nervous system, we realize that nerve impulses are generated and then they're sent to the body tissue to react. The sympathetic nervous system is definitely stimulated by physical or emotional stress. So we think about the sympathetic nervous system reacting in ways, you'll hear about situations where people are in a crisis situation. Just the other day I saw something on the news where the flooding that was going on down west, down in Texas, I believe, and a vehicle had went in the water, and the mother could not get out. She could not get her child out, and someone stopped, a complete stranger stopped, and was able to get additional help, but they were able to literally lift the vehicle out of the water and be able to, to get the child and the mother out of the vehicle. So it's amazing what kinds of things that can happen in the body when that sympathetic nervous system kicks in, and that is definitely a moment when that happened. There's the protective mechanisms designed to help us cope with stress or to get away from stress, and we refer to that as our fight or flight response. And of course, how long that kind of response lasts, but depends on the amount of neurotransmitters that are present within the body. And so we're going to talk a minute about those neurotransmitters. Now, specific responses that includes with the sympathetic nervous system is an increase in our blood pressure and cardiac output. We have increase to the brain, blood flow to the brain and heart and skeletal muscles, because those are our main primary organs of function, especially in moments of stress. And then we'll see a decrease in the blood flow to the other organs, to the skin and the viscera. That's not needed for an emergency response. We will also see an increase in the blood sugar or glucose level. Other things that we'll see are an increase in that mental activity and being able to think clearly, and our muscle strength and our heart rate, blood coagulation, and the rate and depth of respirations and sweating will increase as well. Now, on the flip side is our parasympathetic nervous system, and again works in the same way as nerve impulses are generated and transmitted to the body tissue. But with our parasympathetic, we have that description as resting, reparative, or vegetative state. And it involves the digestion, the excretion, heart or cardiac deceleration, and near vision. And about 75% of our parasympathetic nerve fibers are in the vagus nerves. And you remember about the vagus nerve. You remember when we did in our assessment class all that checking for the vagus nerve just up in the brain area, but it involves greater areas than just that. And as your notes say, it involves the thoracic and abdominal organs, the heart and the lung, esophagus, stomach. So, you can read there the small intestines, liver, gallbladder, pancreas, and upper portions of the ureters. And so sometimes you may hear somebody say, well, a patient had a vagal response, and we refer to that a lot of times as I'll give you an example when that happens. A vagal response happens sometimes when patients are having to strain for a bowel movement, for constipation. A vagal response can happen, and what happens with a vagal response is it drops the blood pressure, it drops that heart rate, and many times the patients pass out. And so that's what happens with a vagal response if you hear that. Specific body responses include dilation of the skin's blood vessels, and then we have a decreased heart rate and possibly even bradycardia. And then we have a constriction of the bronchial smooth muscles and contraction of the urinary bladder and a contraction of the skeletal muscles. So here is what I refer to as pictograms. But that's not really the correct name. I just call it that because that's what I can remember them as. But this just shows you that sympathetic fight and flight, an S for stress, and then the parasympathetic is the rest and digest, and think of the P as peace. So we've mentioned the word neurotransmitters, and there's several neurotransmitters in the body that you've learned about, but with this particular part, it's going to be important for you to know about acetylcholine. And so that is one of the main neurotransmitters of the autonomic nervous system. And it is, if you look at the spelling of that, ACETYL, and then at the end, choline. So choline, cholinergic, okay, is formed in cholinergic nerve endings from choline and the acetylcoenzyme A, catalyzed by choline acetyltransferase, okay. So that's how it's formed. And so after acetylcholine stimulates the cholinergic receptors, then it is destroyed by the acetylcholinesterase enzyme. Okay, so we've got neurotransmitters that help all of this autonomic nervous system to work. And the way it's formed, you can see, is it's in the cholinergic nerve endings. There's specific enzymes there that help form the acetylcholine. So acetylcholine, it stimulates the cholinergic receptors, and then once it does that job, it is destroyed by acetylcholinesterase enzyme. Okay, and that's how it all works. And that's going to be significant when we talk about one of the drugs in another unit here that you'll learn about. So it is significant for sure. Okay. Acetylcholine is released by the nerve endings or from the nerve endings, and we see these nerve endings in several different places of the body, particularly in the brain. Plays an important role in memory, in the gut or the GI tract. It helps with normal secretory or motor activity, and then in the urinary area, it helps with muscle contraction or relaxation to facilitate urination. Okay, so cholinergic receptors, there's several types out there, and again, you don't need to try to learn all of these exactly, but just knowing, okay, how does all this work? I think if it can make sense to you, it will be beneficial when you put two and two together as you're studying the different drugs. So cholinergic receptors, we have the nicotinic and we got the muscarinic. The nicotinic, there are three types. And they're in the motor nerves and skeletal muscles, and they help produce muscle contraction. The muscarinic is there's 5 different types there, and it's in most of the internal organs, the cardiovascular, respiratory, GI, and GU tract, and it can either excite or inhibit function. Now, medications that affect the ANS or the autonomic nervous system. So when we have medications that affect the body as stimulating the sympathetic nervous system, you're going to hear them referred to as several different names. Sympathomimetic, adrenergic, alpha and beta adrenergic agonist. So these are ones that stimulate, okay? And we've studied about the adrenergic. We've studied these drugs in 236 with the cardiac unit, the alpha and the beta adrenergic agonists. We've studied those. So these are ones that stimulate the sympathetic nervous system. Then we have the ones that block or oppose the sympathetic nervous system. And so those are referred to as the sympatholytic, the anti-adrenergic, or the alpha and beta adrenergic blocking drugs. Okay, so those are blocking. Those are going to oppose or go against. Okay. Sometimes you may hear that also referred to as antagonist instead of agonist. Medications that affect the body as stimulating the parasympathetic nervous system are going to be called the parasympathomimetic, cholinomimetic, or cholinergic drugs. Okay, so again, just think of the name, just think of that neurotransmitter, acetylcholine. It's made with the cholinergic, the choline, the cholinergic. Okay, and so that all involves drugs that are stimulating that parasympathetic nervous system. And then medications that block or oppose the parasympathetic nervous system are called the parasympatholytic, anticholinergic, or cholinergic blocking. Again, you may see that word antagonist thrown in there with anything that blocks or opposes the normal function.